Her Path, the podcast for successful, busy women looking for purpose, health, and happiness. Today, we are going to be talking about boundaries. And first, we will learn what boundaries are and what they are not, and why they are essential for your emotional well-being. Then we will explore how establishing boundaries will help you create the life and happiness that you desire. And finally, we'll show you how you can use it to change your life so you can have more peace in your life. Are you ready? Let's get started. So let's start with defining what a boundary is. A boundary is something you create for yourself, and it's commonly used in coaching to achieve life-changing results. It can be mistaken as a way to control other people, but that's not the function of a boundary at all. An emotional boundary is very much like a property boundary. It delineates when one person ends and another starts. It's a way of drawing a circle around behaviors and ourselves. It may seem that boundaries would separate us from others, but really they do quite the opposite. A boundary includes a request that you make of somebody to change a certain behavior and a consequence of what you will do to self-protect yourself if they violate that boundary again. And because healthy boundaries promote self-responsibility and empowerment, they lead to closer relationships with the other person. By contrast, weak boundaries promote enmeshment and emotional childhood behavior, which only distances us from others. So let's talk about when and how to set a boundary. Before setting a boundary, you must be clear to yourself about what your personal boundaries are. Most people have a clear line around their home, which makes it easy to know when somebody has crossed it. However, many people aren't as clear about their personal boundaries, so often others are unaware that they have even crossed one. So for an example, do you allow people to yell at you? And if not, what do you do when this happens? And some people have a boundary in this area, but there's others that don't. Additionally, boundaries need to be communicated only when somebody has violated them. For example, most of us have a boundary that involves not tolerating physical violence. However, we don't walk around saying, hey, by the way, don't hit me or I'll call the police. So once a boundary has been violated, that's when we communicate to that person that they have crossed it and clearly state the consequences if they don't stop. So if somebody comes in your backyard and they have violated that boundary, you can either lose your shit and yell at them and say, hey, you need to leave. And if you don't, I'm going to call the police. By saying this, you're letting them know what violation that they've crossed and that what you're going to do about it. So we use 2 steps to effectively set an emotional boundary. The first is the request. You ask somebody to stop doing the thing that infringes on your property, literally and emotionally. And 2 is the consequence. You tell the person what you will do if they don't comply with your request. And the boundaries that you set are meant to protect you emotionally, and so you need to clearly communicate when a violation has occurred. So for an example, you may set a boundary with your boss who yells at you by saying, listen, if you continue to raise your voice at me, I am going to leave the room until you can speak calmly. If it continues, I will go to HR to discuss the situation. This ultimately allows your boss to choose how they will behave, but clearly describes what you will do if the violation continues. You can make the request, give them the option to do what they would like to do, and then you follow through on that request. So maybe you have a friend who's always late, and you decide you could interpret this behavior as wrong, bad, or she's being disrespectful to you. And maybe you decide that you don't want to get together with her any longer because of that. Another option is you could decide to set up a simple boundary. Rather than shutting your friend out of your life, it may sound something like, hey, listen, I really want to meet you for lunch, but I know sometimes you run late. I'll wait for you for 15 minutes, but then I'm going to leave. I'm not going to be mad at you or upset. I just don't want to wait around for more than 15 minutes. Setting a simple boundary like this allows your friend to be who she is, and she can behave the way she chooses while allowing you to protect your emotions and your time. Many people confuse requests with boundary issues. So for an example, I wish my husband would take out the garbage. I would like my mate to be more romantic. Or I would like my boss to give me more praise. I want my friends to call me back when I call them. These are requests that fall under the definition of the manual rather than qualifying as boundary issues. And a manual is an instruction guide we have for someone in our lives of how we would like them to behave so we can feel good and happy. Now, I'm not saying it's not okay to make requests of other people, but when your happiness depends on their fulfilling the requests, you're going to have a problem. You cannot expect to control other people, and you don't need to. In these previous examples, the person isn't violating your personal or physical space by not honoring your request. It's not a boundary issue, and it is not appropriate to create a consequence. Boundaries should always come from a place of love and kindness. A boundary is not an ultimatum, and it's not a way of controlling another person so that we can feel better. Proper boundaries come from love. So if you find yourself angry, frustrated, and mad, you will definitely want to work through these emotions before you do any boundary work. Remember, the reason you're upset is not because the person has violated your boundary. It's that you have not set proper boundaries and you have not been speaking the truth of them. When you can own that and take responsibility for your own emotions, you can explain your boundary from a place of love and set clear consequences for what will happen if it isn't honored. And remember that the person in the relationship gets to choose how they will act. When you set a clear boundary and it isn't honored, you will need to follow through on the consequences. And that is a hard thing for most people. Many people worry about being viewed as bad or rude or uncaring or unloving. Or they react from a place of frustration and anger. But remember, the person isn't doing anything to you. It's your boundary and your consequences, and you want to enforce it from a place of peace and love. There's no need to ridicule the other person or make them feel wrong or bad for their behavior. It's just not necessary. So when you're setting a boundary, emphasize for yourself and the other person that this is how you're going to be taking care of yourself, and it's not against them. Be clear about upholding the boundary, because many times that person will continue to violate the boundary because in the past you haven't had one. So they keep doing what they've always done. But when you honor and take care of yourself by enforcing your boundary continuously, that will change. And I'd like to talk about some times or signs that you are not ready to set a boundary. So if you don't feel peaceful and loving in that relationship, it's not an ideal time to set a boundary. If you're angry, upset, or frustrated, work through those emotions before doing the boundary work. Another sign is if you're trying to manipulate somebody's behavior for your own benefit to avoid having to follow through on consequences. And the other sign you're not ready to set a boundary is if you're blaming, frustrated, negative, and trying to delete someone from your life. You are not in a place well suited for boundary work. So, in a situation where somebody decides they want to eliminate somebody from their lives, they might ask for some boundary work. But the desire to delete people who are triggering something negative in you is understandable. It's not a boundary issue. Instead, consider that that person who triggered you the most can be your greatest teacher. Many people get upset at that idea because they don't want these difficult people in their lives. However, if we step back and examine the situation, the people who set us off the most are able to do so because we either don't know how to set up boundaries or haven't done so properly. And removing them from your life may seem like an easier option, but then you miss out on the opportunity to understand where your boundaries are and how to properly set them. You can ask yourself, what can I learn from this relationship? Especially if that person is a family member or someone you've known for a long time. And ask yourself, how can I use this as an opportunity to take care of myself and really create an authentic relationship? Boundaries are the most amazing, wonderful, and difficult things to implement. They are beautiful tools that can create intimacy in our relationships rather than blocking them out. They don't keep people out of our lives. They simply keep people from violating important spaces. Setting boundaries is telling the truth to ourselves and to people in our lives. Also, remember that following through on our consequences 100% of the time is absolutely critical to make this tool effective. And remember, if you are willing to have the courage to honor yourself, tell the truth, and ultimately protect yourself, you will see an increase of peace and intimacy in your life. So, ladies, what has setting boundaries done for you in your life? And I'd like to start with Elise, or what your thoughts are on boundaries. Yeah.
Thank you for all of that. I think that was such important context and information for our listeners and really a great refresher for me. So first I'll say, I spend a lot of time talking about boundaries with my clients. So it's a universal thing that we don't spend a lot of time thinking about, but really does help with our relationships. And I do it with, around relationships with parents and relationships with siblings and relationships with colleagues and bosses and church leaders. It's universal, right? I'll share that I, have had to do some work around boundaries. We have very, very dear, close friends. We call them family members. They're huge, members of our life, and they're, very close to our kids. And, as it is around our country these days, there were some pretty significant political differences. And the politics got to a point, we're a family that doesn't really talk to other people about politics. We like to just leave that. But our one of our friends was very vocal about their views on politics, and it was a little bit attacking at times. And we had a conversation about it and said, we've been friends for 30 years. And we don't want this to come between our friendship. And, and we set up some boundaries. I said, look, it cannot impact my children. The comebacks on social media have to stop. There were a couple of like tactical things that we did. And then we just worked through it, and we were able to have, they're still some of our closest friends, and we call them family, and they are enormous, positive influences on our kids' lives. And we've been able to work through that, but we went through some really tough and painful times in order to get there. So I bring that up as a way to say we can't minimize that piece about it's not about shutting people out of our lives, because that almost happened with us, just because of the fear of what was happening. And I'm so grateful every day that we were able to create some small boundaries and eliminate that and let our friendship continue to thrive. So, as you were talking, Beth, it really just brought up a couple of instances where we've had to have those conversations. And I just think that your relationships like mine was worth fighting for and worth the uncomfortable work of putting up boundaries.
Yeah, yeah. And I think that part of our brain, the survival part, that doesn't want to put in the effort and energy feels like it would be easier to just let that relationship go.
Yeah,
But this is family. This is a relationship with, a history of 30 some years. And, to be able to have to speak clearly and to speak your truth and to say, not to have to let the other person change, but if you do this, then I'm going to do this. And, we would love to stay in your life. How can we make this happen?
yeah,
Yeah, that's
yeah,
for sure.
yeah.
Yeah. How about you, Nancy?
Well, I want to talk about something for me is I grew up without boundaries being modeled at all. So, which was not good, but it's what it is. But I realized that we can have emotions that happen in our body when our boundaries have been violated or ignored. And for me, I dealt with bad anxiety and panic. And I realized, after about a year that my boundaries were totally non-existent. So I think I take that into my work with my clients now. And a lot of people will have physical symptoms such as tension, headaches, stomach aches, things like that. And it's really boundary violations, which is fascinating. When I talk to them more about their relationships, they really, their eyes kind of get really wide. And we do a lot of coaching around that because the physical symptoms can be a sign of a boundary violation, as well as emotions like resentment, angers, feeling guilty, or feeling like you're obligated to do things for sure is something. So I think just to take it one step further and talk about the physical symptoms and emotional symptoms of not having good boundaries, they're like guardrails, right? And when we don't have them, our immune system gets impacted. There can be a lot of autoimmune things going on when people don't have good boundaries. So for me, that's been something that was really eye-opening to look at the kind of physical and medical implications of that. A lot
Yeah.
of people have a lot of buried trauma, that needs to be released from not having good boundaries. So that was something that's really been important to me to recognize that in myself first. And then when you see things in yourself, you see them in other people as well.
Yeah, that's really fascinating having like bad boundaries or no boundaries show up physically in our bodies. Yeah.
Yeah. A lot of headaches, a lot of high blood pressure, heart problems for sure, problems. There's lack of boundaries, and people don't really realize it. They give their power away, and that's your solar plexus area. So it's huge.
Yeah. How about you, Gabby?
Um, I'm going to talk about in my job, I've had to be okay with having boundaries, and it's mostly with my patients and with the workload. There have been times, many times during office visits when what a patient requests for their treatment is not what I learned to be, like medically necessary or part of standard of care. And they can sometimes be insistent, or something that's managed by a specialist that's above my scope of practice. And, I mean, no, can you manage this problem for me? I don't I can't afford my copay to go see this specialist, or, this is just what I've always been prescribed, or I read on Google and this is what I need. And you should just prescribe it. It's really easy. You can just send it to the pharmacy. And so learning how to say no and be okay with it took a while to, you know, be able to say no and my rationale for it, and that's it. And no, pleading or, there have been times when I've been given an article or educated and learned something new, and it's been like, okay, wow, I just learned something. So, all right, let's give it a try. And other times when it's no, it's a firm no. Or when, couples come together and the other person's not my patient, but then they start talking about their medical ailments and, wanting some medical advice when they're not my patient. It's not ethical for me to do. So learning how to, manage that and be okay with, look, you should really talk to your doctor, or why don't you establish care with me and make an appointment and we can talk about it at that time. Or getting messages, nonstop from patients with new medical problems through the patient portal, and it's not appropriate to be doing medical management for a new problem, and being okay with sending them a message saying, sounds like you need to make an appointment. Can you come in at this time, at this time? Before, I felt like I was obligated to always answer all the questions, always treat right in that instant. That was really burning me out, feeling like I had to make everyone happy. I had to answer all the questions. I had to do everything that was asked of me at that point in time. And realizing that setting those boundaries for me not only helped with my feeling of satisfaction with my job, but also helped me take better care of my patients, and then help them learn our standard of care and get into the practice of knowing I should just make an appointment instead of sending 10-page email to the doctor. I should just, and so kind of got my patients in a habit of knowing they should make an appointment for new medical problems instead of sending me long emails through the patient portal. So it just led to a lot of more work satisfaction, and I felt like my patients were a lot more satisfied as well. But it was hard at first. I felt like I had to do everything, say yes to everything, try everything, prescribe everything, manage every single problem, and it was impossible.
Yeah.
And then they would ask for more and more and more and more.
Yeah. Give an inch, take a foot.
Oh yeah. And then when I wouldn't respond right away, they'd be like, hello, I sent you a message 5 minutes ago. Didn't you read my message? Where's my, because I would like really try really hard to get to all the messages as fast as possible. And then when I didn't respond right away, my patients would be like, what's going on? This is such inefficient care. You're supposed to respond to my message as soon as I send it to you.
Yeah. It sounds like people pleasing, which
A lot
is
of that.
the
Yes.
absolute opposite of self-care and boundaries and showing people that you care. So if you find yourself in that people pleaser mode or mindset, to take a step back and see how you can set up a boundary for yourself to be able to teach people how you're going to respond if they do something
Right.
that puts you first, and then ultimately it brings the relationship closer and also brings more peace to your life, which is, I think, so many of us are looking for peace and happiness in our life, and we are the ones that are able to create that.
Yeah. And there's a clear relationship of what my role is in this relationship, and what and the expectations of the relationship are just a lot more clear. And so there's a lot less misunderstanding as well.
Yeah.
And so then it's better care for my patients, better job satisfaction for me. So it ends up better all around.
Yeah, boundaries are win-win.
Yeah.
Yeah. Anybody else want to share their experience with boundaries? I think this was a good a good lesson for us that sometimes boundaries are not people doing things that we wish they would be doing. That's something, a different topic for another podcast. But that boundaries don't come from because you don't care and you're not loving. It is the opposite of that. And if you find yourself in a role of people pleasing and constantly putting other people first, it's a opportunity for you to step back and reevaluate the situation and see where you could maybe draw some emotional boundaries to protect yourself and further develop a closer relationship with that other person or persons. So if you found this helpful, please like this episode and share it with a friend. And until next time, take care. Hey, one more thing before we leave. This podcast is for informational and entertainment purposes only. We are certified professional coaches, but this broadcast is not a substitute for medical or psychological advice. Okay, thanks for listening. See you next week.